So cancer is diagnosed with a couple different ways depending on the cancer type. So sometimes we have to do an endoscopy where we go down a person's throat with a camera, or we go up someone's bottom with a camera. Sometimes we do a chest x-ray or a CT scan. Sometimes we do an MRI, checking someone's brain, for example. So lots of different ways that we can find cancer. One of the best ways that patients can actively try to have any cancer found at an early stage would be to participate in screening tests with their primary care doctor.
A biopsy is when a doctor will take a tissue sample through a variety of ways to assess if there's cancer cells in that sample or not.
Oftentimes, until we go in there and take a sample of it, especially if it's solid, we don't know that for sure. So that's why we're doing the biopsy, just to take a very small piece of the tissue to make sure that it's not cancerous. But most of the times it is benign, so something to keep in mind. Benign is not cancer, malignant is cancer.
You may have heard the term stage when it comes to talking about cancer, and this is something that a doctor will give you, and it is really tied into your prognosis.
The different stages of cancer are really going to vary based on disease site. So each different kind of cancer is going to have its own staging system.
You can have cancer like a stage 0 cancer, which has an excellent prognosis, and then that goes up depending on the type of cancer you have, how large it is, and if it's spread to other parts of your body.
But it's really going to depend on the exact disease type, and that would be something an oncologist would discuss very specifically with a patient so that they understand what that stage means.
Coping with the cancer diagnosis is very challenging, and it looks different for everybody. Sometimes we can struggle to cope, and at various stages. And so if there's something that already works for you, we definitely encourage that you continue to use that. But there are also many relaxation strategies that we can use to help reduce stress, anxiety regarding the diagnosis, maybe future treatments that you'll have to endure. And then also, we talk a lot about just kind of getting comfortable with some uncomfortable feelings as well that can reduce that stress too. I really find benefit in structure, so trying to add routine as much as we can, morning or nighttime routine. Also adding healthy diet and exercise can really be beneficial as well. I think something that is so important to stress is patients are not comfortable with these uncomfortable feelings, and we sometimes label them as good feelings and bad feelings, and we don't want to feel these bad feelings, and that's normal, that's natural. However, this is a very uncomfortable experience, and we're all human, and so we have these difficult emotions. Sometimes we are not very kind to ourselves, and so in a way, we think we're coping, but really, we're saying and we're trying to convince ourselves that we're staying strong. But what that means is, I'm not dealing with these emotions. And so we're trying to cope by staying strong, when really, maybe if we took some time to look at these emotions, it might actually be a little bit more beneficial. As long as you're safe and your daily functioning is not completely disrupted, give yourself some time to sit with those and let them kind of come and go as they present, versus trying to, maybe stuff them deep down inside or looking for a solution for them. Oftentimes there isn't a readily available solution for going through part of this cancer journey. And so taking time to just kind of be comfortable and get to know these feelings a little bit more, because they do come and go as you go through this. I think that's a really important topic to discuss that doesn't get discussed enough.
That first visit with your doctor after a diagnosis can be very overwhelming. I'm sure you have a lot of questions swimming through your mind, like how advanced is the cancer? What treatment plan might I have? So the biggest thing is to bring somebody with you to that appointment and try to prepare questions ahead of time. You can write it down on a piece of paper, or even put a voice memo or a note in your phone so that you don't forget to ask those really important questions. But for that first visit, you really want to get a good understanding of what type of cancer it is and what possible treatment plans might be available to you. Telling your family that you have cancer can be a really difficult conversation. They're often going to have questions that you don't know how to answer in the beginning. So everyone can decide when the right time is to share that information.
So selecting who we choose is important. Obviously, we want to tell our loved ones, spouse, children, but also, anybody that may be potentially providing care.
One thing I like to encourage my patients to do is to find that point person in your circle of friends or your family that you can give updates to, and then they can relay that information to your friends and family. Because as the patient, it can get challenging to repeat the same information over and over and over again to friends and family. So finding those important people in your life that can share the message is a really great way to get started.
So a second opinion, a second opinion is basically where you're asking another clinician, another physician for their opinion on your diagnosis. You can get a second opinion on your pathology slides. So when tissue is taken out and the pathologist looks at it, they render a diagnosis. Some patients decide that they want somebody else to look at the slides. Sometimes the pathologists decide they want somebody else to look at the slides. You can get a second opinion on any care of your treatment. You can get a second opinion concerning your surgical options. You can get a second opinion concerning what the medical oncologist recommends. So basically, it's another discussion, it's another person, another set of eyes looking at your case, looking at you, and coming up with a treatment plan.
It's very important, like I said, to set some time aside. We have very busy schedules with treatment, family, maybe we're taking care of children or we're still working. So it's very important to make sure that we're setting a small chunk of time aside, at least each day, maybe 10, 15 minutes to get some self-reflection. Maybe you find peace in prayer, gratitude, meditation. Set some time aside for those. Otherwise, life happens and we don't get to those, right? So it's important to set some time aside to relax and devote some much needed time to ourselves. As a spouse of somebody who is going through cancer treatment, that is also very stressful. And so we really encourage that spouses and caregivers also devote time for themselves to take care of themselves. We neglect our daily task a lot of times as caregivers. We neglect our diet, appetite, exercise, because we really, care and love for our loved one that's going through this difficult time. So we still encourage that they also take time for themselves. We have something called caregiver rights. You have the right to take a break. That's very, very important. And we need, to take care of you as a caregiver so that you can be there for your spouse. It's also very important to keep open communication between, the caregiver, spouse, and the patient. Everybody's needs can change, and they do change as we go through this journey. And so what was working before may not be working now, or maybe we need extra support in a different area. And so keeping that communication open is so beneficial for both the spouse and the patient. So everybody's on the same page. You're in this as a team, and not one person is taking on maybe more of a burden. You guys can do that together. So going through treatment can be very overwhelming. And everybody's different. Some patients really like to know a lot of information. They like to know the medications, the side effects, all these different things that are affecting them, and other patients don't want to know much at all, and that's okay. Everybody's different. But it's really important, like I say, to use those supports. Maybe your family members can be taking notes while you're there at the appointments, and they can be keeping track of everything. Allowing them to help you is very, very important. So that way you can focus on being able to relax, be present, get through these treatments. Again, relaxation techniques are very important. Some deep breathing to get through some of these treatments that can be uncomfortable.
Cancer is very individualized. We learn about new treatments for cancer every single day, and so your treatment plan is going to be specialized for you and your type of cancer. It's common to ask others that may have been through cancer about their treatment plans when you're first learning about what's going to come up for you. But understand that somebody might have the same type of cancer as you and a totally different treatment plan. So going into that visit with your provider, come armed with questions that you might have about your treatment plan, but trust that they're going to give you that individualized, specialized care that's important for you and your type of cancer. Getting ready for your first chemo treatment can be very overwhelming. I can say from experience that the cancer center is usually cold, so bringing a blanket can be really helpful. Plus, you're going to be getting fluid in your IV that might make you feel a bit chilled. They do have warm blankets for you, so don't be afraid to speak up if you do need a little extra comfort in that area. Having something to drink is also really important. So if you have a stainless steel tumbler or a water bottle that you can bring, you want to make sure you're good and hydrated both during chemotherapy and after. So having something to bring from home is a comfort. And lastly, bring something to do. A lot of chemotherapy treatments can take hours, so having something to keep your attention can be helpful to pass the time.
Paying for cancer treatment is really a loaded question. It can depend on your diagnosis. It can depend on your financial situation currently. It can depend on your insurance altogether. With OSF, we do have different programs that we've created. I think initially when you get a cancer diagnosis, financials may not be the first thing you think of. You probably think of your family. You probably think of your own self and what's going to happen in your future. But when it comes to financial ends of it, generally once you get that diagnosis, we do have someone there reaching out to you at OSF. Someone to let you know that we're here whenever you're ready to go over those financials, to talk about what options you have. We created a program with our financial navigators where they'll take a look at your current coverage and see, what's going to be covered according to the care plan that your provider put in place for you. What's not going to be covered and how can we manage that? If you're underinsured, we have programs out there where we'll take a look at that and see if there's a better coverage out there that you may be able to sign up for. Depending on your situation, that could be immediately, or it may have to wait until open enrollment. We also screen for financial assistance to see if you qualify for our sister's charity. We screen for Medicaid if you're not insured. We try and make sure that we're getting you covered and your services, so that's the least of your worries. Within our cancer centers, some of the programs that we created were where we look for different copays and grants based upon your diagnosis. So sometimes there are outside resources outside of OSF where we can get your coverage or your medications paid for. There are in different communities across Illinois and Michigan, we do have some areas that will help us with assistance with getting to your appointments and possibly even getting your meds. Always choose the treatment. I don't think a financial barrier should ever stop a patient from treatment. If their provider is suggesting they have treatment and that there is hope, I would never, ever say skip the treatment because financially you can't afford it. At OSF, that's the last thing we want you guys to worry about. That's why we created a financial navigator program in our oncology departments, is so that patients hopefully don't ever have to come to that decision. So one of the options that we do have at OSF is payment plans. If you are even considering, and it's going to be a high dollar test that you need for follow-up, don't skip it. Do not skip it. Go talk to a financial navigator. We have them at almost every single facility, and they can help you stretch a payment plan out all the way up to, I think it's past 24 months for some cases, just depending on the dollar value, and they can tell you what that's going to be. And it's so simple now. We have automatic payments you can set up, so you don't even have to think about it. Just remember it's coming out of your account, and it's not as big of a bill when you have it broken up over, a course of so many months. That would be my suggestion. And also, when you're signing up for your benefits, make sure you're looking at that. What is your deductible? What is your out-of-pocket? Make sure you're paying attention to that, because I think it does make a big difference. And I think there just needs to be more education around those, what the benefits are and what the deductible means to us when we do sign up for it. When our patients come in for a consult initially and they are diagnosed, they are referred to our financial navigators. Our navigators also have a system where they see everyone that's coming in for a diagnosis that day, and they will always get their business card. If they're up for it and they want to meet with the financial navigator that day, they're always available to meet them. If they're not available, or if they're not feeling up to talking about finances that day, they do get the business card, and we do follow up and reach out to them as well. To prepare to meet with a financial navigator, I think thinking financially is probably the best bet. Try and make sure you have your information available. We'll need to know your income, your house size. Sometimes we'll need your tax information to submit that depending on the grant's qualifications or requirements. And really just coming prepared and sharing with us, if you're open to it, what are your biggest financial concerns? What are you having trouble with? Is it transportation, getting to and from your appointments, or is it I can't afford my medication? Just really coming prepared and being able to be open and sharing what you need.
So during chemo, it's very important to make sure you're eating as well as you can. A lot of times, just kind of in general, we want to focus on making sure that you're eating enough to maintain your weight, and that's at no matter what weight you are. Because that way we know if you're maintaining your weight, you're getting those nutrients that your body needs to help it work and fight what it needs to fight and heal the healing that needs to go on as well. So we want to make sure you're eating enough to maintain your weight. But the other thing that's really important during chemo too, and pretty much during any kind of cancer treatment, would be to make sure that you're getting plenty of protein. So protein during cancer treatment really helps to make sure that your body has what it needs to do all the different work that it needs to do to keep your immune system strong, help you keep fighting what you need to fight, keep your muscle strength up. So those are kind of the two general things that we focus on, making sure you're eating enough of during chemo. We do sometimes change what you're eating though based off of how you're feeling with the chemo. So sometimes chemo doesn't make you feel so good. You may have nausea. In that case, then we would change the foods that you are eating to make sure that whatever you're eating isn't making those side effects worse. So we do kind of want to make sure you're eating enough, but it may need to change from your normal. There are some foods that can kind of help to just not make the nausea worse. So we want to go with more of our bland foods. Kind of think of what you ate when you were maybe a kid and you had, some sickness. You got chicken noodle soup or, dried crackers, dry toast sort of thing. So those types of foods we would want to go for. But we also need to remember too that you need to be getting some protein in your diet. So we have to find some ways to get some, what I would say, more blander types of protein. Maybe it's just some cooked chicken breast, which can be very nice and bland, not too many seasonings. Or maybe we look at drinking a protein drink of some sort too that won't upset and make the nausea worse too. So those would be some foods we definitely would want to avoid. The spicy foods, anything greasy, fried, that's really going to be kind of heavy in your stomach isn't going to be helpful for nausea.
The medications you receive for your cancer treatment can absolutely disrupt your sleep. There are some medications like steroids that have a side effect of insomnia. So after taking those medications, you may find that it's really challenging to go to sleep at night or even stay asleep. One of the things you can do to combat this is to have good sleep hygiene at night. Put your phone away an hour or two before bed. Try to stick to a routine where you go to sleep at the same time every night, and make your bed comfortable. If you feel more comfortable with a cool room, turn that thermostat down a little bit so that you can get a solid night's sleep. When you're going through treatment for cancer, you want to make sure you're getting good rest so your body can heal. Feeling normal is such a challenge after you've been through cancer treatment. This is something that has disrupted your entire life, and it will be a milestone moment in your life moving forward. Normal is a hard term term to use because nothing feels normal when you're going through cancer treatment. But I can say that you will find a new normal after treatment is over. And for a lot of patients, sometimes that new normal is better than how you were before cancer. Exercise will absolutely help your recovery. Sometimes going through cancer treatment, you could be really tired, and the last thing you want to do is exercise. But one of the best things you can do for cancer fatigue is moving your body. That means just getting up and taking a walk some days might be all that you can accomplish. But the more you move your body, the better you will feel and the faster you'll recover. Chemo brain is a term that we use to describe mental fogginess or memory loss that can happen after certain treatments for cancer. What's interesting is that you can have chemo brain without even having chemo. There are other types of cancer treatment that can also produce this type of fogginess. It can be a challenge, especially if it's something you're suffering from significantly in your day-to-day work, but there are some things that you can do to help improve that concentration and that memory.